Hi, this is Dr. Brian Hong. Welcome to Oakridge Orthodontics. The number one reason people seeking orthodontic treatment is misalignment of the teeth or dental crowding. Now, in case of significant crowding, many orthodontists will ask the patient to have their teeth taken out or removed. Now, if you understand, teeth actually serve many important functions other than just chewing or food. The teeth help support your jaw structure and therefore give you face volume. It also provides space for the tongue and therefore is very important for speech and also swallowing. Imagine if you have many teeth taken out, it's going to impact those important functions. At Oakridge Orthodontics, we like to think outside the box and always provide a treatment option of non-extraction orthodontic treatment, which means correcting your crowding without taking out teeth first. Especially in young growing child, we can expand the jaw structure, make the retrusive jaw structure go forward, and correct bad habit. All those methods would help create space and therefore avoid taking out teeth. Here's a case with severe crowding in a young child. She still have most of her baby teeth present. You can see the arch are very narrow and all the back teeth are tucked in at the back. Now she is suggested by her dentist and another orthodontist that 8 of her baby teeth, including 4 of her adult teeth, need to be removed to help solve these crowding issues. Obviously, that sounds quite invasive, and the parents was not very convinced of this treatment approach, and they come to see me. And I suggest, since the back teeth are lean-inked, we like to see if we can use expander, widen the arch first, and when we see how well the space can be developed once we expand the arch. And this is what we did. As you can see, after the expansion, those teeth start to come in, and we have to keep all her teeth at this point without any extraction. So how do we do it? Let me show you very quickly. So this is before, this is the bottom jaw. You can see how the bottom teeth are crowded at the front, and the back teeth molar are narrow-inked. And this is after we expand. You can see we expand the back teeth with this E-arch expander. Okay, you can see the spring here. The very gentle force gradually expand the arch. And most importantly, you see those front teeth, they actually align themselves spontaneously just by creating space for them. So obviously we correct her crowding problem without needing to take out any teeth at this point. This is another case of very severe crowding. As you can see, at the front right here, the teeth are so, the space is so insufficient that this canine is actually going towards the outside right now. And if you look at the other side again, there's not quite enough room to fit another whole tooth in there. However, when I look at this case, I realize the front teeth are lean back right here and right here, and also the back arch is also lean-inked. Plus, when we lost the baby tooth, we pick up a little bit of space at the back. So I suggest let's try to expand the arch first and see how much space we can create for him. And as you can see, after we expand the arch and create space, we're actually able to fit the canine in nicely at both sides at the same time, create a very nice and rounded arch for him. So this is on the top, and let's take a look at the bottom. Again, bottom is very crowded too. You can see this canine is being pushed inside. And on the other side, it's even more severe. You can't even see its canine. It's totally blocked out. But what's going to help us is that he still had this big baby molar left. As you can see on the other side, when you lost the baby molar, you actually pick up a little bit of space because adult tooth to replace the baby molar is a bit smaller, spatially in the bottom arch. And after we expand and create space for him, we're to create space, allow the canine to come in at both sides. And on top of that, we get enough room to fit all the teeth in the arch, or 14 of the lower teeth here. Alright. Without any removal of healthy adult teeth. Now, what about adults? There are still many different options that can be provided to create space, such as we can use appliances like carry visualizer to move the teeth back and create space at the front to align the front teeth. Now, if you have a crowding problem and the only solution given to you is to have teeth taken out, and you have a question about those treatment methods, please do not hesitate to contact us. We'd like to see how we might be able to help with your situation. Thank you for watching, and hope you like what I shared with you today.